We're just gonna keep rolling on this thing. Todd, you can kind of go and I'll stop sharing my screen right now for you so you can.
Okay.
Todd, you can run at kind of whatever pace you want. We do have somebody at the next hour, so anything within that, you're good to go. It's kind of your show, your territory. We are running out of the Q&A. I do want to remind everybody in case you missed in the morning and stuff. Keep the Q&A for actual questions, not just like actually just talking and stuff like a chat box, right? We have the chat box turned off for this event. Just keep it Q&A to keep it simple. And then, yeah, Todd, you can either answer them, do your flow, either answer them at the very
Yeah.
end or as you're going, however you want to do that.
Sounds good. Sounds good. Not again, I'll probably hit them at the end as I can't see the chat screen while we're presenting. So
Cool.
I'll just kind of open it up at the end. How does my screen look? Does everything look clear on your end?
Looks perfect. I got national rollout and
Yeah.
the mother and daughter walking.
Perfect. All
Yep.
right. That's the start of it. So I'll go ahead and kick it in if you're ready to go.
You're good to go, man. It's all you.
Awesome. All right. Well, thanks everybody for being on the call. My name is Todd Passer, and I'm with United Healthcare. I am the agency manager for the states of North and South Carolina, but I'll be hosting this national rollout because I am responsible for the relationship with Healthcare Solutions team. So I'll kind of preface that by again saying, my knowledge is very strong, state specific, North Carolina, South Carolina. But again, I have a good understanding of kind of our national position. And one thing we'll talk about later in the presentation is how I can facilitate connections and introductions to other agency managers throughout the country. So, again, I'll do my best to answer questions at the end. If there are things that are state specific, we can kind of talk about takeaway and how we can facilitate answers for you. So, again, thanks for joining me today. We're going to dive into the evolving ACA marketplace. Certainly a landscape marked by rising uncertainties around subsidies and regulatory shifts that are reshaping how our consumers are going to approach their health coverage. But here's the exciting part. United Healthcare is not just navigating these changes. We're trying to lead the way with marketplace plans that redefine what's possible in healthcare. So exciting year, a lot going on. So let me flip to today's agenda. So we're going to cover a market overview, including the landscape strategy for 2026, our consumer experience, our product offerings, network, and some operational enhancements. So we're going to try to touch on, those the kind of the five main pillars of what you all need to know and get you prepared to sell in 2026. So let's begin by diving into our market overview. So we all know that the landscape has changed. It's changing. It's fluid. Our goal is to adapt and give your members the best experience possible. We've got the anticipated expiration of the enhanced APTCs. We've got probably going to be a shift in enrollment channel mix, and we've got policy reforms on the federal level that are going to impact, the way in which we do business. So, again, we do this. How do we help you all in 26? We do this by expanding our market footprint and product offerings or benefits where it makes sense. We reposition the existing products to remain competitive, and finally making sure the incentives we offer are relevant and appealing to our IFP consumers. So that's just kind of our product strategy objectives on a national basis, and we'll dive into some of the particulars of those as we go along in the presentation. So overall, our national footprint will remain the same this year. We do have some changes at the county level in some states, and we'll talk more about that. You will see in the select markets this year, we will have mirrored plan offerings without pediatric dental embedded to help lower costs. So, again, in select markets, offering mirrored plans without pediatric dental embedded. So that's new for this year. And then HSA eligibility, per the budget reconciliation bill, all on exchange bronze plans are now HSA eligible, regardless of high deductible health plan status. So, again, IFP footprint, no changes with United. We'll talk about some state specific county level changes. But That gives you a good look at what we're doing nationally. And then also, what we're doing is we're expanding our off exchange offerings this year as well. Our strategy is to be ready and relevant in the market should ICHRA enrollments increase and become a more popular choice for the employer groups. While we're not certainly putting all our eggs in the ICHRA basket, some markets are more prime than others to see growth, and we'll be well prepared to meet that market demand should it arrive. So in 2025, or currently, off exchange plans only existed in 7 markets. For 2026, we're expanding our portfolio in Wisconsin and offering off exchange silver plans in 17 additional states. And then, special for Georgia, we're launching a statewide commercial individual product, which is supported by our choice network. And we'll talk a little bit more about what that looks like. So let's call Georgia kind of an interesting pilot market for us, to sort of appeal to that ICHRA play, if you will. So, again, in 2026, we'll expand our off exchange portfolio in Georgia by offering plans utilizing our commercial choice network, which is obviously much more broad than our ACA networks. And that may be more attractive for employer groups considering, that ICHRA strategy. So our goal is to execute on offering consumers a broader network, then take the learnings and potentially expand beyond Georgia in the future years. So what we refer to is, we're referring to this as Georgia UHC Complete off exchange. So UHC Complete is specific to Georgia, and those are ICHRA focused products off exchange that will utilize our choice network. So again, we can educate you, more about that. So year over year growth and competitor moves have increased the visibility and attractiveness of ICHRA. So we're launching, again, that commercial plan using our broad commercial network. There will be 8 UHC complete plans offered statewide across all metal levels: 2 bronze, 4 silver, and 2 gold. So if you're selling in Georgia, and you're interested in kind of that ICHRA play, just be aware that we've kind of made this investment in Georgia. The other thing we're doing is we're introducing a new anchor provider partnership. So in 2024, if you sold in our Texas market, you should be familiar with our partnership with Kelsey-Seybold in Houston. We're now going into year 3 of that partnership. But new for January of 26, we're introducing a new anchor partnership with Sanitas in the San Antonio market. So this partnership is very unique. It's a brick and mortar concept, otherwise known as a clinical model. It's single payer, exclusive to United Healthcare, and it is exclusive to IFP. So again, if you're selling in the Texas market, specifically that San Antonio market, Sanitas might be a great offering for us there, in addition to the already established Kelsey-Seybold offering in and around that Houston market. So there's a lot on here. I'm not going to read it, but Sanitas is a leading multinational health group that serves members through their comprehensive health model, which is based on prevention, identification, and management of health risks, and the control and management of disease and dependency. So again, the whole idea is to raise the standard of care. And this is quite a unique model system within, select markets, specifically in that Texas market to start. So, what these locations are going to be in and around that greater San Antonio area is going to be Alamo Heights, Castle Hills, downtown, Leon Valley, Live Oak, Northwest, South Side, Stone Oak, and Westover Hills. And again, I've got one more slide that talks a little bit more about this, but again, Sanitas is well positioned in and around that San Antonio market, very visible healthcare provider in that area. So what exactly is value-based care? It's a healthcare delivery model that focuses on providing better care for patients while reducing overall healthcare cost. Instead of being paid based on the quantity of services provided, like traditional fee-for-service models, providers are compensated based on the quality of outcomes of the care that they deliver. So just a different, you'll probably hear other carriers start to refer to that. I'm not familiar with other carriers that are doing this, but value-based care is certainly a buzzword. It's a concept that seems to be having some good success. I will say this: if you want more information on Kelsey-Seybold or the Sanitas offering, I will probably need to facilitate a connection to one of our agency managers in Texas. But later on in the presentation, I will have a slide and I'll talk to you more specifically about how to link to the contact information for the agency managers throughout the United States. All right. So here's just a very high level 2026 footprint summary. Again, not going to read through this specifically, but there are several states that we do not have any footprint changes for 2026, meaning we've made no additional counties or taken away any counties. Things will remain as is currently in those states noted in that top section. We do have footprint changes for 2026 in several states as well, as noted here. So again, if you're selling in any of these states that do have footprint changes for 2026, again, it may be advisable to link up with our state-specific agency manager so you guys can talk at a more organic level about what those changes are in those states. And again, I'll have the contact information or link to the contacts later in the presentation. Some states, the changes are minor. Some states, they're more significant. I manage South Carolina, and unfortunately, we have a pretty significant change in South Carolina. But footprint changes mean we may have added some counties. Doesn't always mean that we have lost counties in those markets. So we'll talk more about that later in the presentation. So we're going to shift a little bit and talk about our consumer experience. So again, our mission is to help our members live healthier lives. That is what we strive for and continue to work to improve your client's experience with us. We know if you put them on our plans, you were the first person they're either happy with or not. So we're going to do our best to make the experience positive. So First thing we're doing is we've invested a lot of time and energy into accelerating our digital engagement because it really does drive results. When our members can self serve with intuitive tools, they're more satisfied. And when members have the confidence to manage their plan on their own, they're happier and less likely to call you in frustration. So, we're going to go through some of the specifics of our digital engagement that I think you all are going to find pretty cool. So, let's talk first about we start by enhancing the renewal experience and allowing what we call pre-effective access for our new enrollees. So new members can now log into the app before their plan starts, giving them time to get set up, explore their benefits, and feel prepared for day one. So, um, again, helping our members not only go through the renewal process, but also uh, really give them a better onboarding experience. Secondly, provider search. That's always a key component to ACA. So we've improved our provider search. Members can now filter by a specific need. They can compare providers side by side, schedule appointments, and even report inaccurate data all in one place. And AI is helping with recommendations related to services and total cost insights. So, by doing this, we've created a 52% reduction of dead end search results since the implementation. So, it's actually helping. We also, referrals and prior authorizations have been streamlined. Members get prompted when a referral is needed and can track it. They can also get real-time notifications when a prior authorization is submitted, approved, or denied with update alerts and next steps if something is missing. And then lastly, members can now view and manage all their claims right in the app. No more jumping between platforms. Plus, the new document center gives them access to everything paperless, such as their EOBs, their invoices, and more. So it's fast, it's clear, and it's always accessible. And let's shift to the most utilized feature in our digital experience, and that's pharmacy tools. Nearly half of our members actively engage with their pharmacy benefit. And this year, we've made major strides in transforming what was once a fragmented experience into a fully integrated one. So we start by redesigning the mobile home screen to bring consistency across platforms. This dedicated prescription landing page serves as a central entry point for pharmacy related actions. And our savings center will alert members on total potential savings across all medications by showing both their spending and their savings. So, again, a lot of great information on our prescription management page. All right. Members also have access to the Health Perks Reward Dashboard, and here they can view a personalized dashboard showing which rewards they might be eligible for, which ones they're ready to redeem, and complete the entire redemption process. So, no paper forms, no phone calls, just a few clicks. And then we also added community resources, which is a new digital feature where members can search by need, submit a self referral, and track and follow up with local organizations that support social needs such as housing instability, financial assistance, transportation, and more. All right, so let's talk a little bit about our product strategy for 2026. And again, we work to prioritize the most important changes needed to better meet your members' needs. So I want to start by looking at which products are available to your members. So again, There are no new product families for 2026. However, you will now see the Bronze Essential plans on exchange in most markets. And again, these will be the most attractive to your cost conscious consumers with lower plan utilization. So, this is kind of our plan product family at a national level. When you get down to the state specific level, um, there may be some small changes in what product families are offered on a state specific level. So, this is a national overview of what we refer to as the required plans. Those are also called standard plans. Our value plans, which tends to be lower premium with higher deductibles and higher cost shares at the time of service with a mix of copays and coinsurance. Our advantage plans, which are mid-range premium plans with lower deductibles and cost shares at the time of service. We do have copay cost shares for many services. Copay Focus, which is a higher premium plan with first dollar coverage and $0 medical deductible. Most commonly accessed services have copays to provide cost transparency. And I can tell you just, I know in North Carolina, South Carolina, but certainly nationally, our copay focus product family has been very popular on all tiers, bronze, silver, and gold. So that I know it's one of our best selling product families currently in 2025 in a lot of our states. And then new for 2026 is our essential plan family, which is going to be available on exchange. It's going to have lower premiums and higher copays. So to get, before I move on to $0 medications, to get much more organic, and I wasn't able to do this in this presentation. Let me back up. Is every state, this is very important, every state will have their own benefit grid, if you will. Okay. So, for example, North Carolina, I can provide you all with our plan summaries or our plan grid for North Carolina. So, again, when we talk about connecting you to each specific state agency manager, they can help you access the plan grids for your specific states. Secondly, all of our plan grids, sometimes we refer to them as shopping sheets, are on Jarvis too. And Jarvis is the agent portal. Many of you are familiar with Jarvis. You should be. Uh, Among other things, your book of business, all kinds of information's available on Jarvis because it is the agent portal. Your plan grids, your network maps, that's all in Jarvis. It always has been. It will continue to be. So again, you'll be able to access your state-specific plan grids in Jarvis and through your state-specific agency manager. All right. Just wanted to get that out of the way. For 2026, we have expanded our $0 medication offering to include new medications at $0 for heart conditions, asthma, mental health, allergic reactions, and opioid overdose. So these are new. So these are just the new ones that are going to be added in 2026 for no cost. So this isn't, the list isn't limited to just this. These are all in addition to the current $0 medication offering. So quite a few there for heart conditions, asthma, mental health, allergic reactions, and opioid overdose. So make sure you check the formulary to confirm which medications as well as dosage or strength, qualify. It all goes back to formulary, but again, on a national level, this is what we're doing. And then we're continuing to support our diabetic members with additional $0 benefits across all plans. We built the foundation in 2024, added even more value in 2025, and we're excited to add pharmacy provided supplies and certain oral medications for 2026, all at no cost to the member. So these offerings, along with our $0 formulary insulin, reflect our goal to reduce barriers to care and help members better manage their diabetes with comprehensive no cost support. So again, just kind of an ongoing benefit that we try to make enhancements to every year. So in 2025, we added routine foot care and nutritional counseling. 2026, we have got new pharmacy provided supplies and oral medication. All right. So again, available to members with diabetes in all states, includes HSA plans. All right, now our product incentives are getting better and better every year. So for this year, our PCP incentive is increasing from $100 to $150 to further incentivize members to complete an annual exam with a primary care provider. Always good to have a relationship with a primary care provider. So that's increasing from 100, what it is currently, to 150. There's also an additional $50 benefit for completing these 4 account-related actions, and that's create a MyUHC account. That's the member account, member portal. Turn on their auto pay feature, sign up for all text message communications, and sign up for paperless communications. And then lastly, $50 for completing a health risk assessment. And that's new for 2026. So the total product incentive is now $250 for our members. And that has increased by $100. So it went from $150 to $250. So we encourage our members to take advantage. Sorry about that. Vision. So with our vision coverage, pediatric vision continues to be embedded in all of our plans. For the adult vision, some of our plans do include adult vision. And when you look at our benefit summaries, the plans that do include adult vision will be very clearly noted on the benefit grid. It's noted with a plus sign. So again, for those of you that want to add a vision benefit, please pay attention to your state-specific benefit grid for those plans that do include the adult vision. There are some states that we are not able to offer adult vision, and that is Colorado, Washington, New Jersey, and New Mexico. And then the dental benefit works very similar. Pediatric dental is on all plans allowed, but don't forget, we will have mirrored plans without pediatric dental this year to lower costs for those consumers that don't need it. And we will continue to offer adult dental coverage on certain plans, again, which remains very popular. Again, the 4 states that don't allow it: Colorado, Washington, New Jersey, New Mexico. And again, when you refer to the state-specific benefit grid, it'll very clearly notate the plans that you're in that do cover the adult dental, or you can include the adult dental. So again, it's very, very clear on our benefit grids, benefit summaries. So virtual visits. Virtual visits will continue to be offered through Amwell and Doctor on Demand. All members 18 plus still have access to our free digital fitness and an optional buy-up for physical fitness membership. We have several tiers, and I'll show you in the next slide kind of what that looks like. And then in addition to that, our members do receive a 20% discount for eligible Walgreens branded over-the-counter health and wellness products. This is a benefit with high utilization, so make sure your customers are aware of that. So uh, again, virtual care, continues to be embedded within our plans, as does the fitness benefit and the Walgreens discount. So more specifically, on the fitness benefit, the buy up benefit, if you will. Again, the digital is free. We have what we call a classic, a standard, a premium, and elite opportunity for a member to buy up. And within each of those four levels, the classic, standard, premium, elite, come a different group of vendors, if you will, gyms, etc., fitness studios. And again, on the digital fitness side, we have over 20,000 classes and live stream options available. We do have classes offered in Spanish. And for those that do buy up onto one of our physical fitness tiers, that does include an AARP membership and a $0 grocery delivery benefit, shipped in Walmart Plus. So again, just wanted to notate that there. All right, so this is going to be really important. This is going to be kind of the gateway to your network maps, your state-specific network maps, your state-specific ACA contacts for United Healthcare. And the other thing we're doing this year, new for this year, is what we call a state highlights overview. It's kind of a one pager for each of our ACA states, that kind of high level overview of each of those states. But please make sure you access the network maps via the QR code. They are also available in Jarvis. And also make sure you scan to access our state-specific ACA contact. So please, if you have questions about a specific state, I would encourage you to please reach out to the agency manager that manages that specific state. And that's kind of the way we work. We kind of divide up the country accordingly. And then take a look at those state highlights overviews. I think they're helpful. So I'll give you a second to kind of look at this and do your thing. And I can always send this to the team as a follow-up as well. All right, we're going to talk just about a few operational enhancements. Don't want to get too far in the weeds on operations because I know there's other information that's a whole lot more important to you, but this is helpful. There are several new features in Jarvis. Again, that's your agent portal that I wanted to bring your attention to. So you all know United Healthcare communicates with your members. Sometimes they call with questions, and it can be challenging if you can't see the document they're referencing. Now, on the member communications page in your book of business, you will find any late payment notifications that have been sent to them with the date sent and how. This is also now available at the agency level, giving agencies real-time visibility across the entire organization. Agents still have access to their individual books, but now agencies can proactively support and assist with payment management. Also, currently, ICHRA identification is optional, but when selected, those members identified will be reflected on your book of business report. This makes managing your ICHRA membership just a little bit easier. So again, we have late payment notifications on the member communications page. We have late payment report now is expanded to the agency level, and then an ICHRA indicator on your book of business report. And we've also enhanced our sales and marketing section within Jarvis to help you sell and retain clients with United Healthcare. The agent training section of Jarvis now includes region-specific training calendars with links right there to register, and topics like new agent orientation, sales development, and much more. Additionally, you can now easily locate summary of benefits and certificates of coverage for your members' plans. So, again, our sales and marketing page continues to be kind of built out. One thing I like here at the top is member videos. We're putting a lot of member videos, English and Spanish resources. So if you haven't checked out the sales and marketing page on Jarvis lately, go out there, take a look. There's some new stuff out there that I think is pretty good. So this is really exciting. We will have it's currently in development, but we're actually just about done and ready to release what we call interactive benefit grids. So these benefit grids will provide information by state in a downloadable Excel file, laying out all the inputs that go into a member's plan selection. These will cover key information, including plan types, deductible, premiums based on family size, benefits, network. They're going to be awesome. So these are going to be in addition. It's a tool that we've developed that's in addition to I'll call our static, plan grids, that you can just grab and download a PDF version. These interactive benefit grids, and again, you'll have a much better idea what they look like once we send them out. But it just is kind of like that static benefit grid, but now on steroids. It's interactive. So I'll make sure that once they are available, I will let the leadership know at HST, and I'm sure we'll probably do a broker blast, a broker communication. It will be known. You all will be notified when these interactive benefit grids are available. And I think they're shooting for, I believe we're looking at probably another week, maybe 2 weeks at the most. So this is just around the corner. And then we also this year have what we call our broker compass, which is a guidebook that showcases suggestions and materials so you can proactively support members if they call with questions. So again, we call it the broker compass, guide to member touch points. All right. So if those tools are new, but what have we refreshed? So we've talked about Jarvis enhancements already, but I wanted to highlight the Jarvis redesign in response from feedback we've been getting from the brokers. So the new experience allows for better organization of materials, making it significantly easier to search for information. We are enhancing this year's materials with more content like ICRA, the member portal, and the UHC app that I talked about earlier in the presentation. So again, that's what's new and different for agents, and just wanted you to be aware of that. So just wanted to throw this out there. Only 39% of IFP members are aware of the potential end of the subsidy expiration. So we've got a lot of work to do to educate our members how the new changes impact their plans and premiums. So again, based on our research, only 39% of the IFP panel interviewed are aware of this potential expiration. Now, I know this could change, obviously, with the government shutdown going on. There has been some discussions about trying to negotiate something with regards to extending the subsidies. But again, I think the moral of the story is, the members need guidance. Whatever way this happens to go, they need your help, and you're super important. So we have developed this I know I sent it to the leadership team at HST. Hopefully, it was distributed. If not, it's a reminder that this guide is available. Understanding the new CMS rules for Plan Year 26, a broker's guide or an agent's guide. Same thing. I use broker and agent interchangeably, but anyway, we wanted to know what the key provisions were, what you should know about those, and again, what you should consider. So very, very helpful. I think each carrier or some of the ACA carriers have put out similar resources for you all, but I would encourage you to um, get out on Jarvis and pull this guide. We're going to be actually highlighting it on our Jarvis homepage, I think, very soon. Uh, every year on Jarvis, we dedicate a section to what we call OEP resources, and it's kind of a link to the most important things for OEP, and that's on the Jarvis landing page. And I think they're going to put this guide under that OEP selling resources section. So it will be very visible for you. So, really important too is please engage our producer help desk. They're a great team. With the sole focus is helping you answer questions regarding contracting, sales support, application status, book of business, commission, everything you can think of starts with our producer help desk. They're available by phone number, by email, and when you're calling in, please provide your producer ID number, your writing ID number, your tax ID number, something tangible that PhD agent can help pull your information. If you're in Jarvis, you can access the PhD via live chat. So if you're in Jarvis, you can also link to our PhD team. But again, every inquiry that's made through the producer help desk, they establish what we call basically a service request number. And that's very important to us agency managers, because if you reach out to us and ask us for assistance on an issue, probably the first question we're going to ask is, did you first call the producer help desk? Because they have to, in essence, establish that service request number. So we can then escalate an issue once that service request number has been established. Okay, so it's kind of a two-part process. Try the PhD first, then engage your agency manager, where we can escalate. Typically, the producer help desk is going to be able to knock out an answer or help you with the issue. And then a big thank you. It's always good to be a part of these trainings. I don't know everything. I wish I did. So much of this stuff is state specific, and really lean on your agency managers in the states that you're selling for more granular information. I also work a lot internally with our ops team. So when agents come to me with operational type questions, I can get to them. I'm a sales guy. I don't live in the ops world. So a lot of our agency managers will lean on our ops team internally to help you all. So I'm at the end of my slideshow. So let me see. What would you like me to do now?
Yeah, you're good, Todd. Thank you so much, man. We really
You're
appreciate
welcome.
you. Yeah, there's a
So
couple questions in the
I'm
chat.
gonna do this. Okay, sounds good.
I can just read them out to you. First one, does you and some of them you might have answered. I'm not certain, but does UHC offer shop plans?
No.
Okay. Let me see. Here we go. All place.
And again, if there's one I don't know, I will definitely,
Yeah.
I'll hit you back. You know what I'm saying? Yeah.
some of these are state specific, right? Like, so
Yeah,
this one, will UHC be offering non-referral HMO plans in Florida? I don't know that you would know that or not, but if you
I,
do,
I don't. So what I would encourage them to do is again contact. I believe Florida is JP and yeah, I would reach out to the Florida agency manager there. And again, if do you need me to pull up that QR code again, just so they have it?
somebody's saying they couldn't access the QR code with their phone through here. They said, is there a website that they can go to get the info or where they can locate info within Jarvis?
I'll tell you what I'll do, Nick. If you send me your email address,
Yeah.
I will send you a document that has all of our state specific agency managers.
Love it. There we
Perfect.
go. So,
And then you can distribute that to the team for any of those who were, the QR code might not be working. Just pop me a quick email. That way I've got your email address, and then I'll in turn send a copy of this presentation along with the agency manager contact list.
awesome. Thank you, Todd. And then
Yes.
last one, that was the last question that came in, is, are the diabetes benefits in a specific diabetes plan or are they available on all the plans? Because they're really good, is how the question was.
All the plans. Yeah.
Okay, cool. That is everything we have for you, Todd. So, Todd, we
Perfect.
really appreciate you taking time out of your day. Thank you
Yes.
so much for stopping by for us.
Yes, Nick. And a quick follow up, guys
Yeah.
and gals, ladies, gentlemen. Commission information will be released soon. I know it's always an important question. Any commission, any bonuses that we're doing this year, that's all forthcoming. That will all be decided probably within the next couple of weeks. So um, stand by on that. But for the most part, yeah. But just when you get a chance, Nick, pop me an email and I'll respond and get you all the content.
Definitely. I'll shoot you an email right now, man. Again, Todd, we really appreciate you stopping by.
All right, and I see Mark Capagrossi's coming up next. He's one of my former partners in crime.
I was going to say something to you in the chat, give you a hard time, ask you a really hard question.
Big shout out to Mark. So y'all are getting ready for a treat. He's good. Good
Love
people.
it. What we'll do, Mark, before we hype you up and get you, we will hype you up. I'll throw some music on and stuff, but we'll take a quick
Perfect.
10-minute break, about 12-minute break, and we'll start at the top of the hour here with you, and then I'll pass over screen to you and all that good stuff, man.
Awesome.
But we appreciate you, Todd, and yeah, Mark, we're excited to have you coming up as well here.
See y'all later. Take care.
Thanks.